That might, I mean, that's obviously a big health problem.
It definitely is.
Then what's the treatment when you first see them when they're 5 years old?
Well, the treatment is, first of all, get a good history from the parents and maybe a history from the teacher. I prefer to start everybody with any kind of like behavioral therapy, see if that can help first. But I really do know for this particular disorder, medication is going to be first line. Therapy does not work as well, say, as it would work for, say, mild depression. ADHD, they really need a chemical change in their brain. So I start there first. However, if they have a comorbid disorder like depression or alcoholism, so that needs to be treated also. And we know stimulants and those type of medicines work in about 85% of the cases. And the kids said it doesn't work, and we try another stimulant, another type of medication, it works in the remainder. So I mean, good treatment response, but it still goes untreated.
So in a child, what are those drugs or medicines that you treat with?
We primarily use stimulants. Stimulants are considered first line. And I may use something else other than a stimulant. I may use some antidepressants. I may use Wellbutrin for various reasons. Say, for example, if a child has a brother or sister that responded to Wellbutrin, a parent that responded to Wellbutrin, I may stick there. I may use Effexor. SSRIs are not really known to treat ADHD, and I don't see any good response from SSRIs. But the Ritalins and the Adderalls, those are the mainstay of treatment.
But you hate to put any child, I mean, that's a medicine they're going to be on for maybe for life. Let's just take those stimulants like Ritalin. What are the side effects of those medicines?
Really, the side effects are really, a few days after they first started, nausea, they may have diarrhea, anorexic type symptoms, they may not eat, so I tell parents to let the child eat first. And they usually dissolve in about a week sometime. I don't see any long-term side effects from the stimulants, but we used to think, and it was also written that it increased the risk of, say, tics. But we don't know that now. We just compound and confusing data on that. We thought it was written that it would stunt a person's growth. And that's even being debated. Some parents and some doctors used to say, well, give them a break on the weekends or a break during the summer. That would help them catch up. But if you give a child too many breaks of the stimulants, then you can actually make a negative impact on the prognosis.
So what happens as that child gets older? Let's say when they're in the teens, are they still taking do they still require the medicine? Sometimes
they don't. For some reason, I think as you grow and the brain changes, I think there are more synaptic connections, okay? Especially if you started out with, say, a decent amount when you were born. You sort of solidify them, and the brain chemistry changes. There's actually, I feel, more dopamine that are naturally in the synapse at that time. So the medicines, I think, just gave the brain a chance to catch up. Because we know it's a catecholamine situation, so it's basically a dopamine in the brain, in between the synapses. We also know that when somebody has ADHD that's untreated from PET scans, these are big-time studies, that the dopamine transport molecule between the ones that catch on to the dopamine are actually increased in about 70% of the patients. So we know it's a brain disorder. Usually those transport molecules decrease when the ADHD is properly treated, or when they no longer have ADHD. So it could be a situation as they get older that the brain resets itself.
So they may grow out of it, but let's say they don't grow out of it in their teenager. How do you treat them at that point? Same drugs, or do you?
Usually, I look more toward antidepressants then. I mean, I'm putting more adults on stimulants, but they usually grow out of the hyperactivity part. I rarely see an adult that's extremely hyper. The hyper part translates into anorescence or pencil tapping for an adult a lot, or maybe mild foot tapping. And it can be pronounced, and if you're working on a job and somebody next to you, they can kind of say, you know, cool down your worrying a little bit. So I have to treat them sometimes with, say, Strattera. Non-addictive type medicine is good for adults and children.
And what kind of a medicine is that?
It's a recently approved FDA approved medicine for ADHD, like one of the first line treatments for ADHD now. That's a non-stimulant type medication. There's no addictive risk to it at all. That's why it's so good, and it's pretty effective. As effective now, we think, as the stimulants. So I think the field is moving towards Strattera and non-stimulants for ADHD. But we know that the gold standard, if somebody has big-time ADHD and a lot of symptoms, we kind of figure, hey, the stimulants are the first line.